Hello, my name is Scott Cavness, and I'm a fourth-year medical student at the UVA School of Medicine. I am also one of the co-presidents at QMD, the LGBT plus Student Physician Society here at UVA, and I've made an 8-lecture series covering an introduction to transgender medicine and the intricacies of hormone therapy, surgical transitioning, social transitioning, and just basic care for the transgender patient. This lecture series is mostly based off of the World Professional Association for Transgender Health Guidelines, which can be found online, as well as Endocrine Society guidelines and the UCSF guidelines for transgender health. Looking at these guidelines should give you the most up-to-date information on transgender medicine, as well as this lecture series should be updated yearly by a member from QMD. Anyone who's interested in gender and sexual minority health, I encourage to become a member of QMD and get involved in medical education. So what does it mean to be transgender? So WPATH identifies gender nonconformity as the extent to which a person's gender identity, role, or expression differs from the cultural norms prescribed for people of a particular sex. Being transgender specifically refers to identifying as the opposite sex as the sex assigned at birth, while there is also the non-binary and third gender identities in which non-binary people find that they don't fit either male or female stereotypical roles, but rather lie on the spectrum between the two. And people who are third gender feel that they don't identify even on that spectrum and identify rather as a completely different gender altogether. It's estimated that about 0.4% of people are transgender in the United States. The people identifying as transgender are increasing, likely due to decreased social stigma and increased awareness of transgender health. Surveys are affected by whether they identify people as transgender as it being a sexual orientation versus a gender identity. And depending on which survey that you look at, the prevalence of transgender identity ranges between 0.15% and 1.79%. It's important to distinguish between sex, sexuality, and gender. Sex is a pretty ambiguous term, often used to either describe chromosomal makeup or physical anatomy, but it can also be interchangeably used with gender. It's a very tricky term to use, so when discussing someone's original sex and chromosomal makeup, it's best to use the term sex assigned at birth to maintain respect for the patient and to avoid confusion. Sexuality refers to physical attraction. It's completely separate from gender and sex. Someone may be heterosexual, homosexual, and bisexual, but people may also be pansexual, which means attraction regardless of gender, including third gender and non-binary identities. So someone who's bisexual are attracted to men and women, while someone who's pansexual might be attracted to someone who's non-binary or third gender, as well as men and women. Someone who is demisexual, their sexual attraction is due solely to romantic feelings and has nothing to do with physical characteristics. There may be other minor sexualities out there, but between these 5 sexual orientations, it should cover the majority of people. If you come across a sexual orientation that you're unfamiliar with, it's perfectly reasonable to ask the patient what that means to them. Gender is a person's identified role in society as it pertains to being male or female. You can be cisgender, in which your sex assigned at birth aligns with your gender, or you can be transgender, in which your sex assigned at birth is different from your identified gender. Someone may also be non-binary or third gender, which we have just talked about. Gender dysphoria, disorders of sexual development, and being transgender are all confused a lot in medical terminology. Just because you're transgender does not mean you have a diagnosis of gender dysphoria. Gender dysphoria specifically refers to distress caused by not living as your preferred gender role. This is often with comorbid anxiety and depression. Many transgender patients feel gender dysphoria, but just because you are transgender does not mean that you have gender dysphoria. Gender dysphoria is often relieved with gender-affirming therapy, either social, medical, or surgical. Disorders of sexual development are chromosomal and hormonal abnormalities that result in intersex traits or discordance between phenotypic and genetic gender. This refers to androgen insensitivity syndrome, Klinefelter syndrome, all the chromosomal and hormonal abnormalities that cause intersex traits. There is some concern about unnecessarily medicalizing intersex traits. Just because someone is intersex does not mean they necessarily have a disorder, but we do have these disorders of sexual development outlined. Someone who has a disorder of sexual development also has a higher likelihood of being transgender, either due to internal hormonal signaling, innate neural pathways that are formed, or due to societal pressures. Having a disorder of sexual development does not mean that you're automatically going to be transgender, but there is a higher prevalence of transgender patients among those with disorders of sexual development. I'd just like to emphasize being transgender does not immediately get a diagnosis of dysphoria. Just because you're transgender does not mean that it necessarily is a pathologic state. And just because you have a disorder of sexual development does not mean that you are transgender or identify as transgender, but there is a higher prevalence. When discussing transgender patients, it's important to simultaneously be as respectful as possible for the patient while also conveying their transgender status in order to prevent medical errors. There are two main ways that you may address a transgender patient. You can say an 18-year-old transgender male presents to the emergency room for abdominal pain. This is the most respectful way, as it identifies them as a male and also identifies their transgender status. However, I've had troubles with other healthcare providers in the UVA system itself who don't necessarily know whether saying someone is a transgender male means that they're assigned female or male at birth. So in order to get rid of unnecessary confusion, it might be better to say an 18-year-old transgender female to male patient presents for abdominal pain. It's slightly respectful as it identifies the patient as a female who has changed into a male, while many transgender patients feel they have always been their identified gender. However, it's more clear to the patient's physiologic needs and healthcare concerns. A transgender male may have potential pregnancy or gynecologic problems. If they still have their ovaries, they may have torsion. So it's much more important to convey their anatomic concerns, especially in an emergency setting. After identifying transgender status, it's always appropriate to use a patient's preferred pronouns. They may also have a preferred name. You should ask a patient their preferred pronouns and preferred names, as they might not be what you expect. Here at UVA, we have a multidisciplinary clinic. Many transgender patients require a lot of specialized care as it pertains to hormone therapy and surgical concerns. Presence of multidisciplinary clinics allow for coordinated care between family medicine, urology, plastic surgery, endocrinology, gynecologists, and mental health professionals, all specializing in transgender care. This allows for the best outcomes for patients. Here at UVA, Dr. Casey, the head of our family medicine clerkship, runs the Transgender Health Services here, now being renamed to Gender Health Services in order to be more inclusive of the non-binary gender identity. It was originally out at Crozet. Now there are plans to move to Pantops in order to provide both teen and adult transgender health, as well as in-house referral to plastics and urology. This is a major change coming to transgender health at UVA and should be a very positive thing. As far as the university itself, for its students, there is transgender-specific care at student health with mental health referral, hormone therapy, access to PrEP, which is HIV prophylaxis, and also sexual health resources. We also have the Teen and Youth Clinic here at UVA, which provides services for youth ages 11 to 26 with comprehensive transgender health services. This includes mental health professionals, people able to diagnose gender dysphoria, and referral for treatment with puberty blockers, surgery referrals, and for hormonal therapy.